Assalamualaikum warahmatullahi wabarakatuh. My name is NURUL SHAHEEDA binti UZIR. I'm from nutrition student. Today I'm going to present to you about ginger. The other name of ginger is Gingiber officinale. Ginger is a member of plant family that include cardamom and turmeric. Historically, ginger has a long tradition of being very effective in alleviating symptoms of gastrointestinal distress. In herbal medicine, ginger promotes the elimination of intestinal gas. Ginger has been used for thousands of years for the treatment of numerous ailments such as cold, nausea, arthritis, migraine, and hypertension. Next, I will pass to the AMIRAH. Thank you.
Thank you so much, Shaheeda. Hi and Assalamualaikum everyone. I'm AMIRAH SAHIRA and I'm going to continue with the introduction of the presentation. Did you guys know that the aromatic, pungent and spicy flavor that came from ginger is mainly due to the presence of ketones, especially gingerols? Gingerols is the bioactive components that contains in the natural oils from the rhizomes of ginger. Gingerol is a substance that contains powerful anti-inflammatory and antioxidant properties, which makes ginger comes with many benefits towards our health. Nowadays, ginger can be found easily in numerous forms, including fresh ginger, pickled ginger, dried ginger, preserved ginger, crystallized, and even candied and powdered ginger. However, if possible, try to choose fresh ginger over the other forms of ginger, since fresh ginger contains higher levels of gingerol. And that's all from me. I'll pass to my friend to give further explanation regarding ginger. Thank you.
Okay. Thank you for the previous presenter. Today I'm going to present about the benefits of ginger. I'm going to introduce myself. My name is ANNISA. As we know, the ginger has a lot of benefits and is commonly being used and widely in Malaysia and also in the world. The antioxidant and other nutrients in the ginger may help and prevent in the arthritis, inflammations, and cancer. Researchers also study about how the ginger can help in reducing the risk of cancer, diabetes, and other health problems. So we're gonna take a look at a few benefits that I'm going to present. First is reducing gas and improve digestion. Second is easing the cold or the flu. And third is help to relieve the nausea. As we know, this kind of problem are commonly in Malaysia. So the ginger also are commonly used to treat this kind of situations. Next is reducing inflammations. Ginger has anti-inflammatory, antioxidant and anti-cancer properties. Because of this, it's thought to boost your overall immunity. For the people with arthritis, its anti-inflammatory properties are particular benefits. Ginger contains anti-inflammatory compound that function in the same way as COX-2 inhibitor. Next is the reducing of the getting risk of cancer. The cancer preventative is mainly due to the radical scavenging, the antioxidant pathway, alteration of gene expression, and induction of apoptosis. This is can lead towards the decrease of initiations, promotions, and progression of the tumor itself. So that's all for my part, which is the benefit of the ginger. Then I'm gonna pass to the next presenter. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Azela Abdul MUSA. Thank you for AINUR ANNISA for the explanation before this, and I will continue to explain about the effects of ginger to immune system and health. Basically, I found that ginger has three effects to our immune system. Firstly is anti-diabetic effects, second is anti-inflammatory effects, and the lastly is antioxidative stress effects. So I will continue to explain about the anti-diabetic effects first. While diabetes mellitus is a chronic metabolic disorder of endocrine system that is characterized by defects in impaired metabolism of glucose, lipid, and protein, as well as insulin secretion or insufficiency. Diabetes type 1, which is diabetes mellitus type 1, DMT1, which is an autoimmune disorder leading to the destruction of pancreatic beta cells. The Zingiberaceae family, of which ginger is a member, consists of many species frequently cited for their antidiabetic and hypoglycemic properties. According to these studies, ginger exerts its antidiabetic effects through restorative effects on pancreatic beta cells, increasing insulin sensitivity, action, and peripheral utilization of glucose. Several experimental studies have reported that administration of ginger extract significantly decreased blood glucose level in type 1 and type 2 induced diabetic animals in a dose-dependent pattern. For example, ginger significantly lowered blood glucose, serum total cholesterol, LDL, VLDL, and triglycerides, and raised HDL. This can be proved in hyperglycemic rats in models that are diabetic deficient in the apolipoprotein E gene or those that have been fed a high lipid diet. Ginger extract consumption reduces plasma cholesterol, inhibits LDL oxidation, and attenuates the development of atherosclerosis in atherosclerotic apolipoprotein E deficient mice. Next, AINUR et al. Showed that fresh ginger extracts led to decrease in the levels of total cholesterol and low-density lipoprotein, which is LDL, in the serum of alloxan-induced diabetic rats. Compared with the control groups, and previous extract caused reduction in LDL to levels comparable to normal group and equal to the effect of atorvastatin given at a dosage of 10 mg per day. Similarly, oral administration of aqueous ginger extract to streptozotocin induced diabetic rats for a period of 30 days was reported to give a dose-dependent anti-hyperglycemic effect. 68% decrease in plasma glucose level at a daily dose of 500 mg per kilogram of body weight, indicating that ginger is a potential phytomedicine for the treatment of diabetes. Al-Quda et al. Also reported that aqueous extract ginger was effective in lowering serum glucose, restoration of hematological indices to normal, and repair damaged pancreas in alloxan-induced diabetic rats. Next, I will explain about anti-inflammatory effects. The potent compounds in ginger rhizome for inhibiting allergic reactions may be useful for the treatment and prevention of allergic diseases. Gingerol, shogaol, and other structurally related substances in ginger raise the immune system. The characterization of the pharmacological properties of ginger entered a new phase with the discovery that a ginger extract derived from the Zingiberofficinae family of Zingiberaceae and Alpinagalanga, also the family from Zingiberaceae, inhibits the induction of several genes involved in the inflammatory response. These include genes encoding cytokines, chemokines, and the inducible enzyme cyclooxygenase 2. This discovery provided the first evidence that ginger modulates biochemical pathways activated in chronic inflammation. The earlier report suggested that in rheumatoid arthritis and osteoarthritis patients, use of powdered ginger for 3 month to 2.5-year period reduced pain and inflammation in 75% patients without any adverse effect, and suggested ginger is an anti-inflammatory agent. 6-gingerol acts as an anti-inflammatory compound that may be useful to treat inflammation without interfering with antigen-presenting function of macrophages. Lastly, I will explain about antioxidative stress effect. The antioxidative properties of ginger and its components have been explored in various in vitro and in vivo tests, strengthening the body's defenses by improving the antioxidant status will undoubtedly protect humans against many chronic diseases. 6-shogaol has exhibited the most potent antioxidant and anti-inflammatory properties in ginger, which can be attributed to the presence of alpha-beta unsaturated ketone moiety. Ginger and Arabic gum showed renoprotective effects in renal failure. These protective effects may be attributed to their anti-inflammatory properties by attenuating serum C-reactive protein levels and antioxidant effects by reducing lipid peroxidation marker, malonylaldehyde levels, and increasing renal superoxide dismutase activity. They could be beneficial adjuvant therapy in patients with acute and chronic renal failure to prevent disease progression and delay the need for renal replacement therapy. That's all from me. I will pass to MAWARDAH.
Hi, Assalamualaikum warahmatullahi wabarakatuh. Okay, so thank you to our previous presenter. So my name is MAWARDAH binti IBRAHIM, and I'm going to talk about the side effects of ginger. Okay, so as we all know that gingers are very popular in treating some problems, but do we know that ginger actually has their side effects when we consume it, maybe in the form of supplements or medications? So now we are going to talk about 4 side effects of ginger. Normally, people who are consuming ginger more than recommended, they will get like heartburn, and if they follow the recommendation, they will probably not to get that kind of heartburn. But instead of heartburn, they also can get like an upset stomach, belching, and so on. Okay, so we're going to proceed with our second side effects of ginger. Some experts believe that ginger is actually can cause bleeding due to its blood thinning properties inside the ginger. Okay, so other than that, there is some expert believe that when you consuming ginger along with other herbs such as garlic, ginseng, okay, so it will like, you know, increase the risk of bleeding. However, this kind of thing still need a research to warrant it. Okay, so what is the relationship between ginger and diarrhea? Okay, actually ginger contain its active ingredient, which is, we'll call it as gingerols. What is the function of gingerols? Okay, so gingerols actually, it will help to pass the food into the intestine. So if people consume more than recommended, so the gingerols inside the ginger will work more than usual, and it will increase the passage of the food into the intestine, and yeah, you tend to get the diarrhea. Okay, so it is very important for you to eat based on the recommended lastly, is it true that consuming ginger will harm pregnant women? Okay, so according to some experts, ginger can actually increase the risk of miscarriage among the pregnant woman, but it will only happen if the pregnant woman consumes more than 1,500 milligram per day of ginger. Okay, so if they consume below than that, the possibility to get the risk of miscarriage is very low. Okay, so I just want to highlight here that it is very important for you to follow all the recommendations. Okay, so that you will prevent all the bad things from happen, even though it is very useful actually in some medications and supplements. Okay, so that's all from me. I will pass to our next presenter. Thank you.
Thank you, Mawa, for the further explanation about the side effect of the ginger. As a conclusion, ginger has been used for thousands of years for medicine purpose. However, excess consumption of ginger may have a serious side effect such as lowering blood pressure, diarrhea, and heart problem. Hence, limit the intake of this root and consult a doctor if you observe the side effect after consumption.